Hello and welcome to this special program. Now, every life is precious. Just imagine if someone suddenly collapses in front of you after a cardiac arrest and you're helpless and unable to do anything. This is not a scene from a movie, but a scenario that is increasingly common with even young adults suffering from sudden cardiac arrest because of sedentary and stressful lifestyles. Without being able to recognize this and deliver CPR quickly, the chances of survival decrease significantly. Every minute, the chance of survival decreases if life-saving interventions are not taking place. It's been proven that bystander CPR improves the rate of survival by almost 50%. It's even more important if you have a loved one with a history of cardiac disease. Research reports that the majority of cardiac arrests occur at home, and CPR knowledge can equip you with the skill and the confidence that you need to transform yourself from the role of a bystander to a lifesaver. And this initiative, Save a Life, is one in which people are being made aware of the early signs and symptoms of cardiac arrest so patients can get to hospital in time, and also people can be trained on giving CPR if the need arises. Well, today, as always, we're joined by eminent cardiologists who help you understand sudden cardiac death and the role of CPR to revive and save a life. We're being joined by Dr. E. Saravanan. He's a consultant interventional cardiologist with the KG Hospital in Coimbatore. Dr. Harikrishnan Parthasarthy, a consultant interventional cardiologist with Apollo Hospitals and Dr. Harikrishnan's Heart Care, Chennai. And Dr. R. Ramesh, consultant cardiologist and assistant professor, Department of Cardiology, GRH, with the Rams Clinic in Madurai. Thank you all for joining us. Dr. Saravanan, let me begin with you. Many of us have irregular schedules. There are those of us who work late and long hours in the office. Would you say that this actually has an effect on our hearts? And are there any precautions that you'd recommend, given that people don't always have control over long and stressful working hours?
So the answer is yes. Stress leads to sympathetic overactivity and adrenaline surge. This leads to increase in heart diseases. Food is not only something we consume via our mouths, but also our minds. So stress is a food which our mind overeats. That is very, very important. So work while you work, play while you play. Find a good work-life balance. 8 to 9 hours of work, at least 8 hours of sleep, and a few hours of relaxation is a must.
Right. Let me also take this across to Dr. Parthasarthy. Dr. Parthasarthy, we see more males with sudden cardiac death. Why is this rate of sudden cardiac death higher in men than in women?
Hi Ankita, I thank NDTV for this opportunity. So if you look at the sudden cardiac death incidence, actually it is 80% because of ischemic heart disease. So if you look at the risk factors for ischemic heart disease, males carry them more. People have high blood pressure, high cholesterol, diabetes, all of them, the incidence is higher in males compared to females. And also stress as such is very high in men because of the stress hormones, adrenaline, all these things they have. They are more like they go-getters and compared to ladies who are a little bit more chill. So I think this is the main reason for sudden cardiac death being very high. The death within an hour is quite high in when they have any symptoms. We have to be very careful, especially with men. But having said that, ladies after reaching the menopause quickly catch up with men and reach the levels very high. So we have to be careful with the post-menopausal ladies also.
Right. Well, in my profession, particularly, Dr. Parthasarthy, I'll tell you there are many women who are equally stressed out and perhaps working as long as their male counterparts are. But Dr. Ramesh, uncontrolled high blood pressure can lead to many complications. So how does high blood pressure actually affect the heart? Is there a direct link?
Hi, Ankita, and hi, NDTV viewers. And thank you for that question, right? So hypertension is called the silent killer, we call actually, because often it is unrecognized by the patient before the patient lands up in a complication like a stroke or a MI or a heart failure. It's more of a vascular disease affecting the blood vessels of your heart, not only your heart but all parts of your body, starting from your head to toe. So it can affect your brain, can cause stroke, it can affect your eyes and cause blindness. Specifically, it can affect your heart, your kidneys and your peripheral blood vessels in both your feet, right? So specifically coming to the heart itself, it can cause three specific abnormalities, right? One is what you call the heart attack or myocardial infarction. The other is heart failure, that is the failure of the heart to pump at a certain percentage or certain efficiency. And the last one is what you call the irregular heart rate, what you call atrial fibrillation, which can lead on to a stroke. So uncontrolled hypertension will definitely cause all these ailments, and specifically in the heart, it can cause a myocardial infarction, your heart to fail or your heart to beat irregularly and cause atrial fibrillation. So all these are the complications of uncontrolled hypertension.
Right. Dr. Saravanan, a high blood cholesterol level is believed to increase the risk of coronary artery disease, but can you also have heart attacks if you have low cholesterol levels?
Yes, the short answer is yes. Studies done in India show that around 50% of heart attack patients have a normal cholesterol levels. So even though our blood cholesterol, our venous blood cholesterol may be normal, cholesterol can still build up in our coronary arteries. That is the arterial cholesterol. Cholesterol can still build up in the coronary arteries and form plaques, what we call cholesterol plaques. When these plaques rupture or erode, this leads to around 80 to 90% of our heart attacks. So plaque rupture, plaque erosion and rupture of a calcified nodule, all these lead to a heart attack. So it is very imperative we control the other risk factors like diabetes, smoking, abdominal obesity, hypertension, etc.
Yeah, okay.
All right. Thanks very much indeed for that response. Dr. Parthasarthy, there's a lot of misinformation about self-care that can be done during a heart attack. Can a person really help himself or herself during a heart attack? And if so, exactly how should they go about doing this?
See, often what we do is like there is a scenario where a person develops a chest pain, and it could be us or it could be one of the colleagues we have nearby. So what we should do probably is, first of all, call for help. Actually, ask the help via an ambulance. That's the first thing to do. And if you're alone, I think what best thing to do is go for take an aspirin if you have one. I would advise actually keep an aspirin spare if you already have a history of heart disease. So take a 300 mg of aspirin. Chewable would be better. And also, if you have statin, you can take a statin, atorvastatin 80 or rosuvastatin 40. And nitroglycerin, that is either it could be administered under the tongue or you could take it as a tablet. That could also be taken. It comes in different formats, isodil or isosorbate, dinitrate, all these things can come. And the next thing you could do is like sit in a quiet environment, make sure you are actually well aerated, make sure the door is unlocked, so in case of any help would be able to reach you, and call a friend or a family member to be around with you. Make sure you don't panic, stay calm, and if you are a bystander, if you find a person who is nearby, then make sure they are comfortable, and make sure you actually, if they don't do well and if you are seeing them not able to breathe, or you can start with CPR also. So the earlier you respond to with blood thinners like aspirin, and also earlier you give a statin as a high dose, all these things seem to modify the fact that the heart attack could get less intense during the course of the period it carries on, and also it can lead on to better outcomes.
Right. Dr. Ramesh, many people get confused about heart attack, cardiac arrest, heart failure. Can you just explain clearly for us the differences between the three?
Certainly, yes. So there is definitely confusion not only among the lay public, even among the educated people, and even among doctors about the difference between heart attack, a cardiac arrest and a heart failure. So all three are different entities pertaining to your heart. So we'll start with cardiac arrest. Cardiac arrest, what is it? Your heart comes to a standstill, right? So your heart suddenly stops. It may be due to any cause, right? Due to a heart attack, a heart failure, even a road traffic accident causing a huge blood loss. All these events lead on to what you call as the cardiac arrest, the heart stops. So that is where what Sir told about the CPR, that is where the CPR plays a pivotal role to revive those failing heart or patient going to standstill. So the other thing is heart attack. Heart attack is the common term what we call medically as myocardial infarction. That is your coronary arteries, the blood vessels supplying your heart is blocked. That can lead on to a heart attack. Again, that can lead on to a cardiac arrest. The last thing is your heart failure. Again, heart failure is another condition where your heart fails to pump at a certain efficiency, what we normally call as 60%, we call as normal efficiency. When that efficiency comes down to say 30% or so, the heart fails to pump. So the patient gets symptoms like a shortness of breath, palpitations. So that is a heart failure. That is a very chronic condition. It is actually treatable. When you treat the underlying cause like hypertension, diabetes or a valvular heart disease, when you treat them, this heart failure reverses actually. It is reversible and completely treatable. So heart failure is a chronic condition. Cardiac arrest is the heart suddenly coming to a halt due to any of the above reasons. And finally, heart attack is nothing but what you call as myocardial infarction in technical terms. That is how you differentiate.
All right. Thank you so much. That was very clear indeed. Dr. Saravanan, what are the current guidelines though for cardiopulmonary resuscitation or CPR in India, and what are the correct steps to carry this out?
So the earlier guidelines were ABC, airway, breathing and circulation. Now it has changed to CAB, circulation, airway and breathing, emphasizing the importance of maintaining blood flow to the brain. The brain is the most important organ in CPR. So the aim is push hard, push fast. So the depth should be at least 5 centimeters and the rate of compression should be 100 to 120 times per minute. So we have to allow enough time for the chest to recoil. The rate of the elbow should be fully extended. The elbow should not be flexed while giving a CPR. The elbow should be fully extended. The patient should be on a flat surface. The rate of compression should be 30 and the rate of breaths, mouth to mouth breaths should be 2. So the ratio is 30:2. So 30 compressions to mouth breaths. In some countries like India, especially where mouth to mouth breaths may be culturally unacceptable, at least hands only CPR is a must to ensure adequate blood flow to the brain.
All right. Thank you all. We will take a quick break at this point, but there is still a lot to talk about. We'll be back in just a moment. Welcome back to Health and Wellness, Save a Life, an initiative through which people are being made aware of the early signs and symptoms of cardiac arrest so patients can get to hospitals in time and bystanders can be trained on giving CPR if the need arises, where we've been talking to eminent cardiologists. Dr. Parthasarthy, if I can come back to you, we've talked about cardiopulmonary resuscitation or CPR being a life-saving technique, but my question is, will CPR always save a life?
No, actually. So what happens is like CPR once initiated due to different scenarios, the different studies show that the survival rate varies tremendously depending on the situation where it is being done. For example, if you do it in a cath lab where there is resuscitation facilities nearly available very readily, actually the success rate is high. If there is a shockable rhythm, if there is a ventricular tachycardia, ventricular fibrillation, the success rate is high. And if there is asystole, there is a flat line on the ECG, the success rate is very low. So the survival rate varies anywhere between 20% to about 70% depending on the different scenarios. If there is an elderly person getting it, if there is a long-standing CPR more than 10 minutes, then the survival rate gets lower also. So this fact underlines the importance of actually getting the CPR done very early by a trained team, like how it should be done. That's the whole point of doing this the talk today. And the people should be well trained. For example, in abroad, we have centers like even supermarkets having AICDs or automatic defibrillators where they could recognize cardiac arrest and successfully deliver a shock when necessary. Here, I think we waste lots of time. So I think we have to have an initiative where we could identify these people early and treat them appropriately. Bystander CPR, right, like you rightly said in the starting of the program, found to be really useful in saving lives.
Right. Dr. Ramesh, if I can come to you, how does an automatic external defibrillator or an AED help a person who is in cardiac arrest?
Right. As I was alluding to in the earlier discussion, so AED is nothing but an automatic external defibrillator. This is part of a CPR armamentarium, right?
Right.
To put it simply, most of us would see a defibrillator seen the movie, James Bond movie Casino Royale, right? In that the Bond actually is poisoned in the casino. He comes out, gets into his car and puts two electrodes or two wires into his chest and then presses the button, right? So again he revives. So that is actually the what we call an AED. That is a fully automated external defibrillator. This is exactly used to revive the cardiac arrest patients. So cardiac heart comes to a stop either due to a ventricular tachycardia or a asystole. So as a sir said, it is very useful in ventricular tachycardia. So the defibrillator analyzes the rhythm, what is the patient undergoing. If it is a VT, what we call ventricular tachycardia, it delivers the shock actually, and the heart again comes back to it is a normal rhythm, and the patient is revived. So again he has to be taken to another hospital for further evaluation and further treatment. So that is the AED. It can have both professional and for bystander use. It can be kept in a airport, your bus stations, railway stations, and even in malls. That is already in use in other Western countries. We India slowly adopting that. So maybe in the metros can start with doing this AEDs specifically kept in these PCP areas like bus stations, airports, and so on. So that you can initiate bystander CPR. Actually, it improves the outcome of CPR. As I said, it becomes more than 50% when you use a AED for a shockable rhythm.
Right. Dr. Saravanan, a person can survive a first heart attack, but are they then going to be at increased risk for another one, and what precautions can be taken in order to reduce the chance of a second heart attack?
So, as you said, the second heart attacks are usually fatal. But so a person who's had a heart attack is always at the risk of a second heart attack. The single most important thing they can do is stop smoking. It's the single most important risk factor, which is modifiable. So they should stop smoking. They should manage their stress, adopt an active, healthy lifestyle, keep their sugars, cholesterol, and blood pressure under control. And more importantly, they should keep a loading dose. Like sir always said, keep a loading dose which has an aspirin 300 milligram, clopidogrel 300 milligram, and an atorvastatin 80 milligram with them wherever they travel. So that during the times of chest pain, they can chew and take these tablets. That is one. And more importantly, we should tell them, at least here in KG hospital, we tell at least their bystanders, one of them, their relatives, to get trained in basic BLS.
Right. Dr. Parthasarthy, is it true that consuming high levels of sodium and low levels of potassium may raise your chances of getting cardiovascular disease?
So, little controversial. I think the evidence is little mixed now, but I used to work in a hypertension research unit in the UK, and the European guidelines are quite strict, and Indian guidelines follow that. So we have to have less of sodium, less than 6 grams per day. It's for a healthy living, especially for reducing blood pressure. And for example, if the low salt reduces blood pressure and reduces the stiffness of the arteries, and hence reduces the left ventricular hypertrophy or thickness of the heart muscle, and also improves the way the arteries relax and less strain on the heart. So all these things put together, and also lessen the chances of developing a heart failure, because salt retains water and the heart has to pump harder against it. So that's one thing, that's one side. But if you take it too low, for example, if sodium is too low, then it can lead on to adverse effects, because tachycardia will ensure, and that will lead on to high sympathetic overdrive. So there is a little bit of mixed evidence, but I think we should balance it on a person-to-person basis. If you lose a lot of salt in way of sweating and things, it might be prudent just to take a little bit that day. But overall, I think we should have a low salt in our diet, which is very useful. Potassium, again, there is a little bit of controversy, but potassium is known to be a good vasodilator. So, and also it could actually help in the way the heart's, in fact, it helps in a way the heart's rhythm is there. So potassium is very important. And also the high potassium diet leads on to lessen of the atherosclerotic process, actually reduces the atherosclerotic process and leads on to more relaxed blood supply. So having a higher potassium and lower sodium should be the motto for when we are consuming the diet.
All right. Dr. Ramesh, could heart palpitations accompanied by shortness of breath be serious?
Certainly yes, right? So both are actually symptoms of a heart disease. They are called the classic or hallmark symptoms of a heart disease. By the way, palpitation is nothing but your heart beating very fast. You're able to feel your heartbeat, right? That is palpitations. shortness of breath, we all know that when you walk or climb stairs, you feel breathless. So both of them are cardinal symptoms of heart disease, right? It can be anything, starting from a heart attack, your heart failure, or any valvular heart disease. All of them can cause these symptoms. This is the way of the heart talking to you, that heart telling to you that your heart is not okay. So go and get yourself checked with your family physician, or if preferably a cardiologist, whether it is due to a heart attack or a heart failure or due to a valvular heart disease. Even palpitations can be even during your exams. That is entirely different. That is very normal, right? But these palpitations in elderly patients, say 40 years, above 40 years, sudden onset, or it is coming very slowly, even it is slowly, you should get yourself checked with your family physician. If he refers to a cardiologist, go to them, get your heart thoroughly evaluated, check whether you have any of these conditions, hypertension, heart failure, myocardial infarction, or whatever it is. So treat accordingly. So don't ignore these two symptoms. Both palpitations and shortness of breath are hallmark symptoms of any heart disease, for that matter.
Right. Dr. Saravanan, this is perhaps basic, but really it's worth reiterating, because sometimes we tend to forget the most obvious things. What is really a heart healthy diet? What should people be eating when they're already being careful about everything else?
So like already said, limit your salt intake, limit your sodium, increase your potassium, decrease your carbohydrates. Indians consume the highest level of carbohydrates, and we consume insane amounts of added sugar. We consume very high levels of added sugar. So balanced diet, reduce your carbs, take healthy proteins, take healthy fats, reduce your use of reused oil. So because my professor used to say, where hotels do good business, the hospitals do fantastic business. So reduce your eating outside, where the more saturated fat, the more reused oil. So reduce your salt intake, and more importantly, stress. So food for the mouth and food for the mind. So that should also be very right. And weight loss, waist loss. So reduce your waist, reduce your weight.
Dr. Parthasarthy, food for the mind as well, and what would you recommend in terms of food for the mind? Would you say yoga is a good form of exercise for heart patients? What else would you like to add to that?
So I would suggest we all relax very well. I think we are all very busy people, and Indian people work really hard compared to, I used to live in UK and Canada for a long time before I came back to India again. So I think Western people know how to balance their hours of work and then come back and spend lots of time with their family, friends, and the Indian people tend to do the work until late night, say 9 o'clock, 10 o'clock. It's very common for people come for checking up our electricity, coming for our plumbers. They all keep working hard. And I think we have to learn to relax amongst the turmoil we have in India. And by that way, we can actually take some big like yoga type of exercises help, take some big breaths during the course of the day, take some time off, during the course of the day, so that you have a break in the middle. Make sure you relax. Make sure that you think positively. Don't have lots of, I would say, people are really too much, stressed about achieving things in India. We have to be first in everything. We have to calm down a little bit. I would suggest just relax a little bit more. Make sure you actually have realistic aims in life. Make sure you spend lots of time in improving your, like a rounded person, rather than trying to concentrate more on work all the time, and take time off and enjoy. So that's what
words to live by, Dr. Parthasarthy. I'm sure we can all take heart at what you've just told us. But thank you all for joining us on this program, and we hope it's been useful to all our viewers as well.